Hi, and welcome back to my channel of Simplified Psychopathology. This is Ritvik Sharma, your host. So we were discussing cognitive distortions on my channel, and I was discussing cognitive behavioral therapy. And in this, I was talking about cognitive distortion. So we discussed some of the cognitive distortions in my last video. Today, I will discuss some of the cognitive distortions which we left. Okay, so my next cognitive distortion in this course is catastrophizing. So in what is catastrophizing is related to jumping to conclusions. In this case, you jump to a worst possible conclusion in every scenario. Like any kind of scenario is going on, and you will get into you will start thinking that something worse is going to happen. Like you're going on a trip, and you will think that there would be an accident and you will die, or you will meet an accident and you will be harmed very bad. So that kind of cognitive distortion can be there. Like, what if my alarm doesn't go up and I'm late for an important meeting, or I'm late for an office? That is also cognitive distortions. Okay, so you will start thinking about a possible worst possible conclusion in every scenario, not even in one scenario. You will start thinking in a pattern, and also that pattern will go on and off like a cycle. So that is also a cognitive distortion. Another cognitive distortion which we will talk about today is personalization. Like, personalization leads you to believe that you are responsible for any event which is going on in reality, and are completely or partially out of your control. Like the any scenario, if somebody is dying, or if somebody is meeting into an accident, or if your partner is ill, or something happened, you will start blaming yourself, and you will think that you are responsible for that event, and also that event is partially out of your control or completely out of your control, but you will start blaming yourself for that event. So that is a cognitive distortion also, that is personalization. Okay, so next cognitive distortion or fallacy we will talk about is control fallacy. So fallacy, in words, we can talk about that as an illusion, misconception, or error which is created in our mind. So if control fallacies is that somebody is controlling you. So like if your boss has given you some work and you're not able to complete that work, you will think that your boss is giving you too much work. So that is also a control fallacy, and nobody else is getting in the office that kind of work. That is also control fallacy. There is a next fallacy that people have, that fallacy of fairness. That if you have done a good thing, you will expect a good thing from somebody else also. So like if you, in other words, you believe you know what's fair and what isn't, and it upsets you when other people disagree with you. Like, you have done a fair thing, but some people disagree with you, and you start getting into anxiety and depression about it. That is also fallacy of fairness. And like, you expect your partner to come home and massage your feet. It's only fair since you spent all afternoon making them dinner. So it can happen that your partner would also be tired, you might be doing some work, so you can't expect, or why are you making that imagination? Your partner might be sleeping, so you can't expect everything from without even telling them, and you're expecting them that thing for them. So the other cognitive distortion can be blaming. So blaming refers to making other responsible for how you feel. You will start blaming other people for how you feel. It can actually, people will, it can actually pass comments or other things, or people create a joke, but you have to understand that you cannot blame others for a behavior or for something you feel. So that is also a cognitive distortion. So another cognitive distortion is should statement. You cannot create a should statement. You cannot comment as a should statement, because should statement is actually a cognitive distortion. Every time you're making a should statement, that is a cognitive distortion, because that is a certain way, which is an exception. So every time you're saying that you think people should always be on time, they can never be on time. They can never be on time, because they're like, sometimes there can be traffic, sometimes there can be anything, sometimes they would be going somewhere, or sometimes there would be something can happen. So a should statement should not be there. Okay. Another cognitive distortion, we will talk about it. That would be the last one. We will talk about it, is emotional reason. Emotional reasoning leads you to believe that the way you feel is a reflection of reality. I feel this way about the situation, hence it is must be a fact, defines this cognitive distortion. But actually, you are feeling. So the way you are feeling it, you cannot think that that is a reflection of reality. It can be your imagination as well, or it can be like you're doing an overthinking as well. So if you're feeling that somebody is doing wrong with you and that person is not doing wrong with you, so that can also be in kind of imagination. Or if that person loves you, and that is a reflection of your reality, but it can be also a cognitive distortion. So you may firmly believe that something bad will happen today because you woke up feeling anxious. That is also a cognitive distortion. So if you woke up feeling anxious or with anxiety, but you are feeling it that it can be like the whole day will be bad. So that is also a cognitive distortion. So in my next video, I will also talk about other cognitive distortion and how we can work upon these cognitive distortion. I will also talk about it. And also I will talk about core beliefs in cognitive behavioral therapy. Thank you. And please like and subscribe my channel and comment in my section if there is any problem or any kind of questions you have regarding this talk. Thank you.